So I welcome you all for our another Friday webinar. You all those who have been attending, they must be aware that every Friday we have been doing webinars to teach the people about the common health problems, especially gynae health problems. And those who have been attending, they must have become very wiser by now. Today's topic is very, very interesting and very less talked about topic. It is about the sexual health. If we see the WHO definition, it is the complete mental, physical, social health of a person and just not the absence of disease. And sexual health, though talked very less about, is something which is very, very important because it concerns everyone's life, whether it is a child, whether it is an adult, or whether it is a senior citizen. Sexual health is part and parcel of human life. So, to cover this topic nicely, we have divided today's presentations in different parts, and I am very happy to welcome my moderator today, Mrs. Ashita Singh. She is a well-renowned and well-experienced counselor, and she has a very good experience in dealing with children and the parents. At the moment, she is dealing with her child and enjoying her motherhood, and she is a full-time mom. But I'm sure the children with whom she has worked, they all must be missing her. She is an excellent counselor. She is also my very, very close friend, and I know her as a person. She is a gem. To be a good counselor, first you have to be a very good person by heart, and that is what all Ashita is about. So I welcome Ashita to start your session, and we are very happy to have you with us.
Thank you so much, Dr. Preeti. First of all, let me begin by saying that it is a great initiative, Be a Diva lifelong webinar series that you started, because it really has given us information and knowledge about various health-related issues. Sitting at home, we're learning so much from you. So,
thank you.
Yeah. So about the current pandemic that has impacted people from all walks of life. So adapting to the change can be difficult and stressful, and it has taken away our normal and replaced it what we are calling the new normal. It has become imperative to focus on our overall well-being in order to tackle and better equip ourselves with the daily stresses of our lifestyle changes. So everyone experiences stress differently. However, women are more likely than men to report symptoms of stress. Often women are so busy that we do not take our time to slow down enough to think about how stress is negatively affecting us. Therefore, understanding self-care and overall wellness can help women manage stress and empower ourselves to make a healthy lifestyle changes. Now, good well-being doesn't mean that you're happy all the time or uninfected by your experiences. It just helps you cope better when life throws you a curveball. Can I have my next slide? So what is well-being?
Yeah.
I just have to wait.
Are you able to see?
Yeah, I'm just gonna, yeah, now I can see. I've closed the thumbnail. So well-being is the experience of health, happiness, and prosperity. It includes having good mental health, high life satisfaction, and a sense of meaning or purpose, and the ability to manage stress. More generally, well-being is just feeling well. So well-being is something that everyone is looking for because it includes so many positive things like feeling happy, healthy, socially connected, and feeling purposeful in life. Well-being emerges from your thoughts, actions, and experiences, most of which we have a control over. For example, when we think positive, we tend to have greater emotional well-being. And when we pursue meaningful relationships, we tend to have better social well-being. Next slide, please.
Yeah.
So types of well-being. So there are various types of well-being, and I'm just going to quickly go through the types with you. So first being the emotional well-being. Now, emotional well-being teaches us how to manage stressful situations in life, how to be resilient in life, and generate emotions that lead to good feelings. For example, when we build skills like positive thinking, mindfulness, emotion regulations, they help us to cope better with stress. We're able to better handle our emotions when we are faced with challenges, and more so, we are able to quickly recover from the disappointments that we feel. Physical well-being, as the name suggests, it is the ability to improve the functioning of the body through healthy eating and good exercise habits. Not only do we feel better, it also helps prevent many diseases by staying healthy and fit. Social well-being. Now, social well-being is the ability to communicate, develop meaningful relationships with others, and especially now to maintain a support network that helps you overcome loneliness. Especially during the COVID pandemic times, it has become so important for us to be connected, to stay connected with our friends, our family, the cousins we haven't spoken to, and I feel we've all done that during this time. Workplace well-being. Now, workplace well-being teaches us the key how to maintain work-life balance, which is again very, very important these days. We all are working and we are all struggling with how to maintain the work front and the home front balance. So workplace well-being teaches us how to do that. It also helps us to find the interest to pursue what we really matter to us and what helps us to gain happiness professionally. As a result of this, we're able to enjoy our work more, stay focused, motivated, and successful at work. And the last being societal well-being. It is the ability to actively participate in a thriving community, culture, and environment. These skills help us feel like we are a part of a community that really supports and helps each other. Now, the truth is, we all struggle, and new struggles can and will pop up, even if you're doing well. But the longer we have worked on strengthening our well-being skills, the easier it is to be for us to be resilient, take actions needed to bounce back, which is the most important thing, to bounce back and continue moving forward. Next slide, please. Thank you. So the most important thing, foundation of well-being, starts with your physical self-care. Physical self-care, how we treat and take care of ourselves, direct correlates to well-being, and it will impact our ability to cope with stress and demands of everyday lifestyle changes. Now, what is self-care? Self-care is a general term that describes everything that you do deliberately for your mental, physical, emotional well-being. As simple as it may sound, many of us pay very little attention to self-care. Therefore, deliberately is one of the most important words used in this definition. Self-care is being kind to yourself as you would be to others. The next slide. What are the benefits of self-care? Improved resistance to disease. Now, when we give our body time to rest and rejuvenate, it helps us better our immune system. Hence, it improves our resistance to diseases, better physical health. Now, taking care of a body helps us to prevent basic small illnesses like cold and flu, upset stomach, which further enhances our immune system. We do exercise, meditation, yoga for better health. So it all helps us to feel better physically as well. Enhanced self-esteem. Being good to yourself and treating yourself like you matter really sends positive messages to your subconscious mind. So it is very important to recognize your self-worth. As we say, we all have it within ourselves. It is important for us to just recognize it. Increased self-knowledge. Self-care takes you to a journey of self-awareness. Very important, self-awareness. What are your likes, your dislikes, your hobbies, your passions in life? So you start getting to know yourself better. More to give. When you maintain a healthy relationship with yourself, you transfer the good feelings to others as well. When you're happy and healthy from within, you pass on the happiness to others. Better productivity. When we learn to say no, we make time for things that really, really matter to us. then we focus on ourselves and our goals and our needs, and it improves our productivity. The thing is, most of us are very busy. We have either stressful jobs, or sometimes we get consumed with technology to make a time for ourselves. So me time is usually the last thing on our agenda. And worst come worst, sometimes we feel guilty about taking time required to take care of ourselves. So getting started with self-care can be a tad bit challenging. So let's find out ways how we can get started with the self-care. The next slide. Ways to get started with self-care. Now, making sleep part of a self-care routine. Sleep can have a huge effect on how you feel both emotionally and physically. Not getting enough can cause major health issues. So begin by getting into a fixed nighttime routine that you follow every day religiously. Exercise daily as a part of your self-care routine. We all know exercise is really good for us. Daily exercise can help us both physically and mentally, boosting your mood and reducing stress and anxiety, and also helping us shed those extra weight. So it's very important, go out for a walk, cycle, or a light jog, practice yoga. Right now, everybody is very fond of yoga and basic breathing and stretching at home, because these are small things that you can even do in your own house. Eat right for self-care. The food we eat has a potential to either keep us healthy or contribute to weight gain. So be very, very mindful of what you eat. Next slide. Say no to others and say yes to your self-care. Now, this is a tough one actually. Learning to say no is really, really hard. Many of us feel obligated to say yes when someone asks for our time or energy. However, if you're already stressed or worked out, saying yes to loved ones can only lead to burnout, anxiety, and irritability. So it is very important, when you're not feeling up to it, it is okay to say no. Take a self-care break by getting outdoors. Now, spending time outdoors can help you reduce stress, lower your blood pressure, and be more mindful. Stepping out and taking in a breath of fresh air always calms you down. Getting outdoor can help you even sleep better at night, especially if you do some physical activity like gardening or walking. Let a pet help you with self-care. Now, for all who have pets, I'm sure they can relate to this. Pets can bring a boost to our lives. From giving unconditional love to providing companionship, pets can be hugely beneficial for our self-care. Dogs especially can reduce stress and feeling of anxiety, and can even lower the blood pressure. Next slide. Take care of yourself by getting organized. Now, getting organized is often the first step to becoming a healthier you, because it allows you to figure out exactly what you need to do to take better care of yourself. Keep a planner ready to write down your thoughts, your work, your responsibilities, which will help you plan your work efficiently much in advance. Cook at home to care for yourself. Now, many a times cooking and baking can be very, very therapeutic. When you are intentionally cooking a meal, you're working on something that is in your control, and that is realistically can be accomplished. Cooking is also an outlet for creativity, trying different dishes, playing with ingredients, and also a way of bonding if you're cooking together with family. Read a book. In today's fast-paced world, we tend to take out our phones for entertainment or comfort, or scrolling through the news that can contribute to our stress, anxiety, rather than helping us. So reading a book can be very, very therapeutic when you engage with the right type of books, be it fiction or non-fiction. When you choose to read what appeals to your thoughts and feelings, you automatically start connecting with your inner being. Next slide, yeah. Ways to get started again. Now, this is again a very good, interesting way to get started. Choose a stress buster that gives you satisfaction, something that relaxes you down. Choose what you like. There are many, many things that you can do at home. You just need to take out time for yourself. If nothing works, just take a nice, quiet corner in your house, grab your favorite cup of tea or coffee, look outside the window, sit, relax, take deep breaths. it is very, very important to rest and take a break. And next slide. Myths about self-care. Now, people think that self-care is an indulgence. Now, what happens is meaningful self-care includes making mindful changes. Now, it is very important when we say mindful changes in patterns of thoughts and behavior that do not contribute to your well-being. Like when we say no, when we're not feeling up to it, it is okay to say no and take a break. Self-care is selfish. Now, it is when you make time for yourself, getting sufficient rest and exercise, you feel more energetic. It will be able to do, you will be able to do more for yourself as well as for your family and the loved ones around you. So self-care is one-time experience. Definitely not looking after yourself is an ongoing practice, it's a lifelong practice. And it is about building your resilience to face hardships and preventing burnouts. Sometimes people think that, most of us actually think that self-care is time consuming. Now, self-care does not require you to take out a huge chunk of time from your busy day. Like I said, if you're feeling exhausted, just calm yourself down, take some deep breaths, and it would help you to carry on. Next slide. Remember this, I will not apologize for taking care of myself. It is as easy as it is. I will not apologize for taking care of myself. And the next slide. Okay, this is really beautiful. I find this slide so meaningful. You are the sky. Everything else is just the weather. Now, even when you do all the work, there are some rare occasions when you feel overwhelmed. Just remember one thing, nothing lasts forever. So on this note, this is about my self-care talk. And now, since we're talking about our health and well-being of women, there's another aspect of health that needs our attention, and that is sexual health. Sexual health is an important part of our physical and mental health, as well as our emotional well-being. Now, it is time to recognize that sexual health is a vital part of our overall well-being and health. We need to break down barriers to sexual health, just like we are redefining the barriers around our mental health. So it is time to get comfortable talking about sexual health and change it from a taboo to talked about. So I would like to call Dr. Sumita Sehdev and Dr. Preeti to share in their insights and knowledge about sexual health.
Thank you, Ashita. It was actually a very, very meaningful talk, and it was totally a new aspect of taking care of yourself and health, because we are talking about mental health, and the health starts from yourself own. So very rightly put, that if we do not take care of ourselves, who else we can take care of? And very nicely put, and also very punctually put. We are well within the time. Thank you so much. And you just stay back, because you will be taking the question answers also. Yes. So now I invite Dr. Smita Sehdev. She is the consultant with the Touch Clinic, to start the topic of sexual health. Welcome, Dr. Smita.
Thank you, Dr. Preeti, for such a kind introduction. And thank you, Ms. Ishita. It was a wonderful and a very informative talk. So coming to the presentation today. So the topic of my presentation today is sexual health and vaginismus. Now, what is sexual health? World Health Organization defines sexual health as integration of the physical, emotional, intellectual, and social aspects of sexual being, so that it enhances the personality and the relationships. It's not merely the absence of disease. Now, What is the incidence of sexual ill health? According to WHO, around 20% of the women are affected by sexual ill health, and around 14% of the men have some sexual problems. Why is sexual health important? Sexual health is important because irresponsible sexual behavior will lead to problems like unwanted pregnancies and sexually transmitted diseases. Sexual development, it starts even before birth and it continues throughout the lifespan. So when the baby is inside the mother's uterus, the sexual development and it starts and it continues throughout the lifespan till death. And a variety of influences have an impact on this development, like genetic influences, hormonal influences, and psychological influences. Now, what are the characteristics of a sexually healthy person? A sexually healthy person has knowledge about sexuality and sexual health. The person has a positive attitude towards body image, and this person maintains a balance between lifestyle and sexual behavior. Now, taking care of sexual health. One should take care of the sexual health, and if the couple is not planning pregnancy, they should take dual protection. And in females, regular pap smears are advised, and the females they should learn breast self-examination. This is to prevent. This is for the screening of the breast cancer. And in the males, they should learn how to examine the testicles, and if they feel a lump or bump in the testicles, that can be an early sign of developing testicular cancer. Now, what are the sexual health problems? They are sexually transmitted infections, sexual dysfunctions, infertility, unwanted pregnancy, and violence against gender. Now, what are sexually transmitted infections? They are also called as STDs or venereal diseases. These are the infections that are spread from person to person through intimate sexual contact. And the commonest STIs are syphilis, chlamydia, gonorrhea, HIV, genital herpes, and genital warts. Now, what are sexual dysfunctions? It's the persistent or the recurrent inability to react emotionally or physically to sexual stimulation. There are many factors which contribute to sexual dysfunction, and the most important factor is the emotional factor. Stress which is seen in our daily life these days, it contributes a lot in sexual dysfunction. Negative body image, like someone can think that she is fat or she is lean. All these negative body images, they contribute a lot in the sexual dysfunctions. Performance anxiety or fear of pregnancy, or if at all she has some previous negative sexual experiences, or the fear of acquiring a sexually transmitted disease can contribute to sexual dysfunction. Then comes the biological factors, the changes related to aging. As you age, there are some hormonal changes, and these can lead to vulval dryness and atrophy, and that can lead to dyspareunia. Certain medical conditions like arthritis, reproductive cancers, spinal cord injuries, and pregnancy can also contribute to sexual dysfunction. Then comes the social factors, like if the couples they don't communicate with each other, or there is some poor communication with the partner, if there is some conflict with the partner, they are not able to share their what they want from each other, then all these things can lead to sexual dysfunction. Sexual abuse towards one of the partner, or uncertainty of how to behave. All these factors, they lead to sexual dysfunction. At times, there is lack of privacy in the house. In the joint families, there is no privacy, and even this can contribute to sexual dysfunction. There are many kinds of sexual dysfunctions. The main kinds are orgasmic disorders, sexual pain disorders, and gender identity disorder. So today I will be talking about the sexual pain disorder, vaginismus. Now, what is vaginismus? It is the involuntary reflex-like contraction of the vaginal muscles resulting in non-consummation of marriage. Now, actually, people, they don't come up with their history, and so there is a limited reporting regarding the true prevalence of this problem. But some population-based studies have reported that the prevalence rates of vaginismus is 0.5 to 30%, and it affects women in all ages, and it is the most common reason for unconsummated marriage. There are two types of vaginismus. One is the primary vaginismus, in which this problem, it persists lifelong, and she is never able to have intercourse. And the second vaginismus is the secondary vaginismus. It is acquired because she gives the history of vaginal penetration without problems. There is a situational vaginismus, in which the women, the lady, she is able to use the tampons or tolerate a pelvic examination, but she cannot have intercourse. What are the causes of vaginismus? It is most often never delineated because it is multidimensional. It can be because of some physical as well as psychological conditions. Now, how to diagnose vaginismus? A detailed history, the medical, the psychosocial, and the sexual history of the lady has to be taken in detail with a lot of sympathetic approach and gentleness. Genital examination has to be done to exclude any organic pathology like herpes or imperforate hymen. But before genital examination, several consultations may be needed before she gets ready to be examined. So before the examination, she should be reassured that nothing will be done against her wishes. The entire control is in her hands. Whenever she says the examination will be stopped, before, tell her that she can ask questions at any time. She should be given the cuspos, the smallest cuspos speculum with which the examination will be done. She holds it and she feels it, so that helps in gaining her confidence. Explain that the vagina has the potential to expand and that the muscle tension caused by anxiety can make penetration difficult. So the treatment of vaginismus, the aim is to break the vicious cycle of stress, anxiety, and pain. Uh, One has to have a lot of patience with these patients and should have a lot of warm and sympathetic attitude. Now, the lines of treatment are exploration of phobias. In the detailed history, one has to take the history of any childhood traumatic experience or any psychological cause should be addressed. She might be having false belief that her vagina is too small. In fact, vagina is a potential space. The entire baby during delivery, the baby is around 2.5 to 4 kgs, and the baby is able to travel. Baby इस पोटेंशियल स्पेस से होकर वेजाइनल कैनाल से होकर चाइल्ड बर्थ के दौरान पूरा बेबी आता है. सो जस्ट इमेजिन कि वेजाइना की कितनी बड़ा उसकी कैपेसिटी है. देन द थर्ड प्रॉब्लम कैन बी शी माइट फियर टियरिंग ऑफ द हाइमेन, एंड जिससे कि पेन या ब्लीडिंग हो सकती है. शी माइट बी fearing that. So she should be explained that tearing of hymen, it's a minor discomfort and it might happen without her awareness. Both the lady and her husband should be educated regarding the genital anatomy and the sexual physiology. The couple should be explained again and again that the brain is responsible for vaginismus and not the vagina. अगर vaginal muscles अपने आप contract नहीं करती, it is the negative thoughts and the beliefs about sexuality which is responsible for this vaginismus. Control of the muscles. Then comes कुछ relaxation exercises होती हैं, especially the adductor muscles. इसमें doctor holds the women's knees together firmly while she attempts to separate them. Then slowly she is allowed to succeed. All these relaxation exercises, they are very beneficial and helps to manage the anxiety. Progressive relaxation, अगर हमने female को progressive relaxation करवाना है, so then alternately tensing and relaxing groups of muscles in a prescribed sequence starting from the feet and moving upwards. And the most important is the Kegels exercise. So Kegels exercise is locate the pelvic floor muscles and squeeze the pelvic muscles as tightly as possible for few seconds, maximum of 10 seconds, and then relax completely for the next 10 seconds. This you can do throughout the day, maybe 10 to 15 times a day, so that this helps in strengthening the pelvic floor muscles. Then comes systematic vaginal. Systematic. हाँ. इसके बाद आते हैं systematic vaginal desensitization. कुछ लेडीज को बहुत फियर होता है कि कुछ भी वेजिनल पेनिट्रेशन का बहुत फियर होता है. इसके लिए कमर्शियली कुछ ट्रेनर्स अवेलेबल हैं, जैसे कि कमर्शियल डायलेटर्स, स्पेशली डिजाइन्ड स्पेकुलम्स, बट द बेस्ट थिंग्स प्रेफर्ड थिंग इज योर lady's own finger, and even tampons are good for this thing. Whatever she wants, the choice depends upon the patient's preference and the comfort level. Whatever she is comfortable with, she should opt for that. Approaches. इस चीज को ट्रीट करने के either gradual approach हो सकती है या rapid approach हो सकती है. Gradual approach कैसे करते हैं कि female smallest dilator से शुरू करके gradually बड़े dilators को use करे और self dilatation करने की कोशिश करें. एंड रैपिड अप्रोच है जिसमें वेजाइनल मोल्ड की इंसर्शन करी जाती है. एंड दीज अप्रोचेस are normally tried for 2 to 6 weeks in 2 to 15 sessions, but rapid desensitization is preferred. And success rates काफी अच्छे हैं, around 72 to 100% success is seen in many in case series. Surgical treatment is almost never required. In fact, ये सक्सेस के लिए अच्छा नहीं होगा, मगर कुछ ऐसे केसेस हैं जिसमें सेप्टम है, वेजिनल सेप्टम है या स्ट्रक्चर है या पार्शियली इनकॉर्पोरेट हाइमेन है. इन केसेस में सर्जरी की जरूरत हो सकती है. देन कम्स बोटॉक्स. बोटॉक्स इंजेक्शन उन केसेस में यूज किया जाता है जिसमें काफी सीवियर या रिफ्रैक्टरी केसेस ऑफ वेजिनिसमस होते हैं. ये बोटॉक्स इंजेक्शन जो है ये आपकी प्यूबोरेक्टलिस मसल, जो वेजाइना के आसपास की मसल है, जो स्पेसिफिकली इन्वॉल्व होती है वेजिनिसमस करने के लिए, उसमें ये बोटॉक्स इंजेक्शन इंजेक्ट किया जाता है इन 3 साइट्स एंड इससे टेम्पररी मसल पैरालिसिस हो जाता है. नॉर्मली इंजेक्शन लगाने के 3 to 7 डेज के बाद यू कैन फील द डिफरेंस एंड इसका इफेक्ट 3 to 4 मंथ्स तक लास्ट करता है. अदर मोडालिटीज, कुछ नॉन इन्वेजिव मोडालिटीज हैं जो लेटेस्ट आई हैं एंड इनके बहुत अच्छे रिजल्ट्स हमने खुद अपने एक्सपीरियंस अपने पेशेंट्स में देखे हैं. एंड फर्स्ट इज CO2 लेजर एंड रेडियो फ्रीक्वेंसी बेस्ड टेक्नोलॉजी। इससे क्या होता है कि CO2 लेजर हम वेजाइना में उसके कुछ रेडिएशंस डालते हैं जिससे कि न्यू कोलेजन ग्रोथ होती है एंड वेजाइनल लाइनिंग मॉइस्चराइज हो जाती है। इससे आपका इससे डिस्परोनिया कम हो जाता है एंड ऑफ कोर्स इससे वेजिनिस्मस या वेजाइनल कॉन्ट्रैक्शन मसल की कॉन्ट्रैक्शंस भी कम हो जाती है। Dr. Preeti, she will be telling you in detail about these non-invasive procedures, the CO2 laser and Ancilla. Ancilla is again a very advanced technology. It utilizes high-intensity electromagnetic technology to stimulate the deep pelvic floor muscles and restore neuromuscular control. So a single Ancilla session, it brings thousands of supramaximal pelvic floor muscle contractions. So both these modalities have helped many patients with vaginismus in our own center. So to conclude, vaginismus is caused mainly by psychological factors. So stress और vaginismus का direct correlation है. So अगर vaginismus को control करना है, so you have to first control your anxiety and your stress levels, and sympathetic and systematic lines of treatment will help in relieving the symptoms. Thank you, and now I invite Dr. Preeti for her talk.
थैंक यू डॉक्टर स्मिथू, इट वाज अ वेरी वेरी ब्रिलियंट टॉक। और ये एक बहुत डिफिकल्ट टॉपिक है एक्चुअली। आप सब जो लोग पार्टिसिपेंट्स हैं, दे विल अंडरस्टैंड कि टू कवर दिस टॉपिक इज इक्वली डिफिकल्ट फॉर अस, कि हम उसको किस तरीके से आप लोग को प्रेजेंट करें कि वो आप लोग की समझ में आए। और डॉक्टर स्मिथू हैज डन अ वेरी ब्रिलियंट जॉब। Vaginismus is a very very common problem which women face, and उससे वो डरती भी बहुत है, and because of social taboo she is not able to come ahead, and it was very nicely covered। और इसका एक कैरी होम मैसेज है कि आपको अगर वेजिनिस्मस है तो आप अकेले नहीं हो, आपके जैसे बहुत लोग हैं, and the help is available and you can always come to us or to your any doctor who knows how to treat vaginismus and get cured of this very disabling problem. Now, WHO has defined sexual health as integration of somatic, emotional, intellectual, and social aspect of sexual well-being in ways that are positively enriching and that enhances personality for communication and love. अगर हम इसको ऐसे पढ़ते हैं कि बहुत ही कंफ्यूजिंग डेफिनेशन लगती है और सुनने में भी बहुत मुश्किल है और समझने में भी बहुत मुश्किल है। इसका सिंपल एक कहना है कि सेक्सुअल हेल्थ इज इक्वली इम्पोर्टेंट, and as any other form of health is important, this is also very important to maintain a harmony with ourselves and our family members and our loved ones. There are various factors जो एक सेक्सुअलिटी को अफेक्ट करते हैं। बायोलॉजिकल फैक्टर्स तो है, साथ में साइकोलॉजिकल फैक्टर्स भी है, एंड कल्चरल फैक्टर्स आर आल्सो वेरी इंपॉर्टेंट, सोशल फैक्टर्स एंड लीगल फैक्टर्स। बायोलॉजिकल फैक्टर्स में क्या आता है, जैसे कि वेजिनिस्मस जो हमने अभी आपको एक्सप्लेन किया, एनी कंजेनाइटल एब्नॉर्मैलिटीज आर आल्सो इन इट। जो वेजाइनल कैनाल होती है is one thing which many people do not know about। केवल vaginal canal के अंदर एक पर्दा होता है या सेप्टम होता है जिसकी वजह से भी नॉर्मल इंटरकोर्स इज नॉट पॉसिबल। उसका बहुत सिंपल सा इलाज होता है कि उसको अंडर एनेस्थीसिया डिवाइड कर दिया जाता है या रिमूव कर दिया जाता है। सेकेंडली, कई बार जो हाइमेन होता है दैट ऑल्सो कैन बी वेरी हार्ड एंड टफ, एंड उसकी वजह से भी one can have problem in maintaining the sexual relations. As the age increases, the vaginal lubrication decreases. Vagina में atrophy हो जाती है, बार-बार infections होने शुरू हो जाते हैं, and the Intercourse becomes very painful and people start avoiding it. So these are the few biological factors which can be easily taken care of and may be contributory factor for your sexual disharmony. चेंज इन लाइफस्टाइल कैन बी अ वेरी बिग फैक्टर. अगर आप सडनली बहुत सुबह उठकर जिमिंग करनी शुरू कर देते हो या वॉक करना शुरू कर देते हो और फिर पूरे दिन का काम आप करके जब रात तक आप पहुंचते हो बेड पर सोने के लिए, यू आर ऑलरेडी सो टायर्ड दैट you are not able to enjoy your sexual moments. So change in the lifestyle is very important factor which hampers your sexuality. The lack of proper place and privacy is also a very big deterrent. हर हर रिलेशन के पीछे साइकोलॉजिकल फैक्टर का बहुत रोल होता है, एंड एज our moderator Mrs. Ashita had put it very nicely in the beginning that psychological factors, self-care are very important for any kind of health. Same way for sexual health also, a good relation in the family, good liking and same interest by the partners, an environment which is built up with tension and pressure can also move someone away from the sexual health. Just like in females, the males can also have lots of problems which can affect their sexual health. They can also affect their sperm quality, and also nowadays what we have seen that men are very much involved, especially young adults are very much involved in the gymming and also taking artificial proteins. Now, most of these artificial products and proteins, though they help in building up the body, but they take you away from a general good health, and it leads to, in fact, testosterone deficiency and also decreases the sperm count. Many boys, they also suffer from decreased desire and libido because of these artificial consumptions which they do nowadays. So healthy eating and healthy lifestyle goes a long way in attaining a good sexual health. Along with the sexuality is one's own very private issue. Now, world is opening up to lots of new concepts regarding this aspect of life. Heterosexual lifestyle we all are familiar with, but now people are becoming more open to accept the homosexuality and also bisexuality. What constitutes the safe sexual practices? Any practice which is not harming yourself or your partner mentally, physically, and also biologically are the safe sexual practices. Normal massages, hugging, body rubbing, masturbation, foreplay, all these they come into the safe sexual practices. One should understand that when you are having a safe sexual practice, you have to not only take care of yourself but also your partner. You should not do any activity which will encourage the transmission of sexually transmitted diseases like HIV, which is known as AIDS, hepatitis B, hepatitis C. There are various other sexual transmitted diseases like human papilloma virus, syphilis. All these things, if taken care of and safe sexual practices are involved, then both you and your partner will be able to enjoy the practices more in a more calm way. There are some unconventional sexual practices like oral sex and anal sex. Now, they are not harmful provided you take proper precautions, as I said, about transmission of the diseases. Masturbation is one thing which many patients, they ask me whether this comes in the safe sexual practice. Now, there is a lot of misconception among people that masturbation is a wrong thing or only the boys can do masturbation. No, even the females can do masturbation, and it comes in complete normal sexual or psychological behavior. It is about playing with yourself, exploring your own impulses, exploring your own body. It is perfectly normal and natural done alone in private. Of course, if it is done socially, it is not natural, but if in your own room, in private, if you are using it, it is a totally normal practice and there should not be any guilt about it. And you can enjoy it in moderation. What are the benefits of masturbation? It protects against several diseases, and also it protects against cancer in a very wide terminology, because when you are having a normal intercourse and the person is suffering from human papilloma virus, it may be transmitted to you, and the human papilloma virus is one of the factor for the cervical cancer. But apart from that, HPV can also lead to skin cancer. So if you take proper protections, then heterosexual practices are not harmful. But if you do not take protection, and then masturbation can in one very very remote way can prevent you from cancer. It gives you a power and self-esteem. It makes you realize that your system is normal. Many times women come to us and they say that they do not get orgasm with a normal heterosexual intercourse, and they feel that is something wrong with them. Usually nothing is wrong with them, and when they masturbate then they are able to get the orgasm. So they that is a way for them to realize that they are perfectly normal. It also is a mood elevator. It lowers the stress levels. It may help prevent lots of infection. And as after the orgasm, it is believed lots of endorphins are released, which put your stress levels to they decrease your stress levels, and they also help you in achieving a good quality of sleep. It helps in identifying your body. It is something which is very strange to know that many women who come to us, they are not even aware of their vulval area and what is the clitoris and what is the vaginal canal. They are not aware of it because of the taboo. They do not know what all is there in their body. So it's a good way of exploring their body. Sometimes it may relieve the menstrual cramps because there's so much of buildup of pelvic congestion, and masturbation can help in giving you an orgasm and relieving the menstrual cramps. And of course, the sexual pleasure, it's a good thing for achieving a sexual pleasure. As I said, it reassures you, and it also improves your self-esteem. Nowadays people are very career oriented, so most of the couples they are together for very less time. So your own physical urges you can satisfy with masturbation, and it's also good relief for the insomnia. Though the practices which I told you, they are the normal sexual practices, but there are also many sexual disorders which are known to the medical science. Gender identity disorder is one of them. Then there are psychological disorders, behavioral disorders, and sexual dysfunction. What can lead to sexual dysfunction? Psychological stress, negative body imaging is very important. As a partner you keep on putting the other partner in stress about the body image, that also can hamper the sexual desire of the partner. Performance anxiety, expectation of failure, fear of pregnancy. That's why I always tell the women that once your family life is complete, or when you do not want to have an unwanted pregnancy, please come and take help of contraceptive methods, because nowadays lots of good contraceptive methods are available which suit to any age. And if there is a fear that you may become pregnant, that also can lead to a negative sexual experience. Fear of acquiring or transmitting a sexually transmitted disease can also be a big hindrance. In females, there can be orgasmic dysfunction, there can be secondary orgasmic dysfunction, vaginismus, decreased lubrication, dyspareunia, and loss of libido. Due to sexual dysfunction, they are unable to have satisfactory intercourse, and this is a very, very common problem. So a lot can be done nowadays to help the people. Laser, one thing which was told by my previous speaker, is a very good and very advanced technology, and it can really help in decreasing the discomfort of vaginismus. Also, it improves the lubrication, and also it decreases the dyspareunia, that is the painful intercourse. Around 31% of men and 43% of women express problems with intimacy, and while many patients have their problems diagnosed as psychological, many procedures like PRP, platelet-rich plasma, it can be used for putting the growth factors and several good nutrients in the vaginal canal or vulval area, which can help in decreasing the painful intercourse. In a female orgasm, many anatomical structures are involved, like clitoris, vagina, and also the nerve stimulation all around, at least in the lower one-third of the vagina, helps in achieving the orgasm. So there is something known as G and O's shots and G spot. Now, what are these G spots? G spot is located roughly around 1 to 2 centimeter on the anterior vaginal wall just below the urethra. It is a confluence of nerve fibers in one particular area, and when that area is stimulated either by penis or by hand tactile stimulation, then it leads to the orgasm in the female. So it contributes to female ejaculation, which is expressed in the form of orgasm. So in many people, this G spot is very thin or it is not properly placed, so it does not get stimulated. So we can help these women by giving the PRP injection over there. Even the laser helps in G spot augmentation and one can become better. Now, O spot is located somewhere this is the clitoral area. So the O spot is located all around this area. So PRP can be injected over here, or there can be micro needling can be done, and there can be so many things which can be done to help this area, and patient can experience a good sexual satisfaction. PRP has got lots of growth factors like platelet-derived growth factor, epidermal growth factor, insulin-like growth factors, vascular endothelial factors, and all these factors, they help in rejuvenating the nerves. That's why PRP is not used only for sexual health, but also for PRP facial, for rejuvenation of your facial skin, for rejuvenation of your labial area and the vaginal area, and it really works. Now, vagina can become dry because of the childbirth also, because of the aging, because of hormonal imbalance, because of recurrent infection. So in all these cases, lasers, PRP, carboxytherapy, HIFU, all these things, they help. So how does these regenerative treatments do? What do? They increase one's own blood supply to the area, and it improves the cellular regeneration and tissue repair. It also releases growth factors and repairs the nerves. It's a very simple procedure. You take 20 cc of blood, your own blood, so that there is no risk of transmission of any infection, from which platelet concentrate is prepared by a special method, and then it is injected at the G spot or O spot. And after laser, I also inject it or spray it inside the vaginal canal, and it really helps in rejuvenation and achieving the sexual desire. So this is the way how the PRP preparation is done. Between 20 cc syringe is taken, and then with that the blood is especially centrifuged with the PRP kit, and then for 12 minutes it is centrifuged. There is 7 times platelet concentration, and there we get the PRP. Now, what are the other reasons because of which women do not achieve orgasm? One is stress, then other medical problems like diabetes and hypertension, hormonal imbalances, lack of adequate sensation, laxity of vaginal walls resulting from multiple natural births, injury to pelvic area, and sagging of skin. All these are the factors which may lead to not achieving the desired effect. So PRP therapy, it helps in regeneration of the epidermis and dermis of the local area, and also the nerve fibers. As I said already, there are no side effects. You are using your own blood. They are maintained in sterile conditions. Results are long lasting because they are regenerating procedures. They do not require multiple sitting, and they are non-invasive. They do not require anesthesia. So the benefits are increased sexual desire, increased arousal, increased lubrication, heightened orgasm, reduced pain during intercourse, and vaginal tightening. Now, results, how long do they last? Many people, they ask me for how long the results will last. See, aging is a process which we cannot stop. So it totally depends on your body aging. If your body aging is less and you are able to take care of yourself, you're supplementing yourself with vitamins, nutrients, you are taking good care of your health, the results may last for a year or more. But if you're not taking care, then The results may last for 6 weeks to 3 months, and you may have to go to a repeat injection of these things. So these are the other uses of PRP therapy which we normally do, and they are very beneficial. So Touch Clinic helps in designing diva moms. We do not just believe in the gynecological part. We believe in your complete health, that is your mental, physical, psychological, and also your sexual health. And there are lots of things which we offer to you. And my only request to all of you is that do not shy away from your problem. If you have any issues, come and discuss. Maybe we might be able to help you. So enjoy your health, enjoy your life in whichever way. Women are beautiful creations of God, and we should respect and we should enjoy every aspect of our feminism. Thank you.
Thank you, Dr. Preeti. It was very, very informative. Something that I don't think so we were very aware of beforehand. So there were a few questions that I got from some women. They wanted to know about certain things. So the first is, what can be done if you feel vaginal dryness and lose vagina?
All right. So thank you for your kind words, Ashita. And answering this question is something which we have been telling for a long time to our patients, that vaginal dryness is a very common thing. You should not be scared of it. You are not the only one. There's literature has shown that 70 to 80% of women sometime in their life suffer from vaginal dryness. So what are the causes? The infection is the most common cause, recurrent infection. Secondly, hormonal imbalances. Thirdly, recurrent vaginal deliveries and trauma to the vaginal area leads to the dryness. So the treatment of it earlier, we used to give only the medications, but now very good technology has helped us with these problems. Laser, PRP are something which have come as a boon for the women suffering from these problems. All these procedures are 10-minute procedure, totally painless. We call them coffee break procedures, and they actually help the women in getting rid of infections, dryness, and vaginismus and dyspareunia.
So when you talk about laser treatment, so does laser actually help in treating painful intercourses as well?
Absolutely. And one can visit our website www.thetouchclinic.com, and there are also Google reviews on it. The patients who have taken these treatments, and they are enjoying a very good sexual life, and they are not facing any dyspareunia. So it's actually a very, very helpful thing, and a very simple thing, and totally harmless thing.
Okay. So another question was, can vaginismus be completely cured?
Dr. Smith?
Yes, of course, vaginismus can be completely cured. It again depends upon the cause, and mostly we know it is the psychological cause. If we using a very sympathetic and gentle approach, if we treat the patient systematically, and then 100%, we have seen there are many case series. They have shown the success rates to be around 100%.
At our center also, we have many patients who came to us initially with vaginismus. Now they all have children, and they are able to have a very good married life.
So a lot depends on how we take the stresses in our life. It all comes down to that eventually. We
Yes,
need to learn
absolutely.
how to tackle our stresses and calm
Yes.
ourselves down. So another question was, are there any reasons for a loss of libido in men and women eventually?
Many hormonal deficiencies can lead to loss of libido, even aging. The reproductive hormones, the estrogen and progesterone, they decrease, and that can be one of the cause of decrease in libido. And you can add something.
Yeah, and the loss of libido is not only in the women. We have to realize that men, in fact, suffer more with the loss of libido. Just like there is a menopause, there is something known as andropause also, which men go through between 40 to 50, 55, 60 years of age. Though they are not very vocal about it, but they also equally suffer. So, loss of libido, along with the psychological and hormonal, there could be also some problem with the, I would say, medical and biological factor also could be there. So, it's always better to come and take help and not just suffer in silence.
Again, a lot depends upon how you come out of it and talk to your doctor openly about it and not feel shy about sharing your sexual health issues. So I think this is
Yeah,
something, a takeaway that we have from today's session, that is very important to talk about your sexual health with your doctor. Don't shy away. It is not a taboo to talk about it. Feel comfortable, because ultimately it is your body and your health and well-being.
absolutely. And there is nothing shy to feel bad about your body or its functioning. And when we can take me, Dr. Smithu, and Mrs. Ashita can speak on these topics so nicely on social media, then I do not understand any reason why, if you are suffering from it, you cannot come forward and take help for your problem.
I think that then there are no more questions in the chat box. So I would like to thank you once again, Dr. Preeti and Dr. Sumita Sahdev, for the time and effort you took to share your in-depth knowledge on the topic of sexual health. So understanding our body and sexual health will get us another step closer to attaining our overall health and well-being. And thank you to all the viewers who logged in. I hope you found the session informative and helpful. Over to Anjal.
Yeah. Thank you, Ashita. It was really nice, and the way you moderated is really nice. This is actually what we wanted, that somebody should moderate like this. So
Thank
thank you so much for your inputs. And now I invite Achal to say vote of thanks. Thank you.
Thank you. Thank you, Doctor.
Thank you so much, ma'am. Thank you, Ishita, ma'am, also. So now ending up the session by telling you some information regarding the Touch Clinic, our services. So first, I announce our last webinar winner, Miss Amarjit Kaur. ये हमारी लास्ट वेबिनार लकी ड्रॉ के विनर है and the services for the touch clinic, we take all precautions for COVID-19, consultation with prior appointments only. COVID testing is done prior to delivery and any surgery. We take off all the safety parameters at our touch clinic. We have our touch pharmacy, quick delivery of medicines available at your home, or at your doorstep. You can call on the number 9613112000. आप इस पे कॉल करके मेडिसिन जो है अपने डोर स्टेप पे मंगवा सकते हैं. Next, we have our touch lab also. You can avail home delivery, home blood sample collection facility. आप अपने जो हमें इस नंबर्स पे कॉल कर सकते हैं. हमारे नंबर्स है 9915496821 and 9915748821. आप इन नंबर्स पे कॉल करके हमारी जो एग्जीक्यूटिव है वो अपने घर पे बुला सकते हैं फॉर होम ब्लड सैंपल कलेक्शन के लिए. ठीक है. लास्ट बट नॉट द लीस्ट, हमारे जो है डॉक्टर प्रीति जिंदल के साथ अगर आप कंसल्टेशन करना चाहते हैं, लाइक थ्रू वीडियो कंसल्टेशन करना चाहते हैं, फोन कंसल्टेशन करना चाहते हैं या फिर विजिट करना चाहते हैं हमारे क्लिनिक पे, तो यू कैन विजिट आवर क्लिनिक ऑल्सो. हमारी जो टाइमिंग्स है वो है 10 to 6 मंडे टू सैटरडे. अपना जो है बुकिंग कराने के लिए अपना स्लॉट आप कॉल करेंगे 9915748821 पे and 9888448803 पे. You can call on the both numbers. And the next जो हमारा नेक्स्ट वेबिनार है वो है 28 अगस्त को, नेक्स्ट फ्राइडे. जैसे कि सबको पता ही है कि हमारा एवरी फ्राइडे सेम टाइमिंग्स होते हैं हमारे वेबिनार के 4 to 5 एवरी फ्राइडे. सो नेक्स्ट 28 अगस्त को हमारा जो वेबिनार है उसका टॉपिक जो है वो एडोलसेंट हेल्थ पे है, जिसके मॉडरेटर है मिसेस अमिता. सो जैसे कि मैम डॉक्टर प्रीति ने भी बताया, हम हर वेबिनार्स पे बताते हैं कि अगर आप में से किसी को लगता है कि कोई ऐसा टॉपिक है जो हमने कवर नहीं किया है और हमें उसको कवर करना चाहिए, तो आप उसके लिए इस नंबर्स पे मैसेज कर सकते हैं. नीचे नंबर्स आ रहे हैं स्क्रीन पर 9915748821 या 9888448803 पे. आप इस पे कॉल करके या मैसेज करके उस टॉपिक के बारे में बता सकते हैं जो हमने अभी कवर नहीं किया है, सो दैट हम उसके ऊपर नेक्स्ट जो 28 अगस्त के बाद जो फ्राइडे आएगा हम उस फ्राइडे को उस टॉपिक के ऊपर डिस्कशन करें. राइट. सो अगर किसी ने मिस कर दिया है बीच में या फिर किसी ने सिर्फ अभी आधा सुना है या फिर किसी को कुछ पूछना है तो वो उस नंबर पे कॉल कर सकते हैं. अदरवाइज हमारी वेबसाइट भी इस पे मेंशन है स्क्रीन पर www.thetouchclinic.com. इस पे जाके आपको सारी वीडियोस मिल जाएगी। जैसे कि हमें 19 जून से लेके 21 अगस्त तक का अपडेटेड वहाँ पे हो जाएगा। 21 का 1-2 दिन तक हो जाएगा, अदरवाइज 14 अगस्त तक हमारे सारे वहाँ पे अपडेटेड है वीडियोस। आप वहाँ पे वीडियोस देख सकते हैं। किसी की अगर कोई मिस हो गई है, कोई भी किसी चीज की भी इंफॉर्मेशन लेनी है, तो आप नीचे जो 2 नंबर दिए गए हैं इस पे कॉल करके इंफॉर्मेशन ले सकते हैं। ठीक है। सो फेसबुक पे हमारा लाइव था, फेसबुक पे ये वाला भी आ चुका है अगर किसी ने मिस कर दिया है तो। ठीक है, तो किसी को कोई भी इंफॉर्मेशन चाहिए होगा तो इस नंबर पे कॉल कर सकते हैं। ठीक है, थैंक यू सो मच, थैंक्स फॉर पेशेंट हियरिंग।